Hand expressing is a really important tool to have in your toolkit when you're learning to feed your baby. We use hand expressing for a number of reasons. For example, harvesting colostrum from 37 weeks, or if your baby is struggling to latch in the early days. We also use it if you're separated from your baby at any point, or if your breast become engorged, you might need to hand express before your baby is able to latch on. It's important that you know how to hand express well, so please do follow this tutorial as a guide. We're going to start with a gentle massage working your way around the breast. When you've done that for a little bit and you're feeling relaxed, you can start to actively hand express. You make a C shape and you place your fingers and thumb about 2 to 3 centimeters back from the base of the nipple, but every breast is different, so please do have a feel where you can feel the change in texture. That's where you'll anchor your fingers and your thumb. You're going to push back towards your rib cage and then squeeze down together and hold, hold, hold. Release, but stay in the same position. Push back, squeeze, hold, hold, hold. You might start to see little glistens or beads of colostrum at that point. You stay in the same position until the drips stop, or you stop seeing those new little glistens of colostrum. Then you rotate around the breast. And if you imagine that your breast is like an orange with different segments, you're going to hand express from each of those segments. When you've worked your way around one breast, you'll hand express from the other side as well. If you can then manage to have a wee and get a drink to refresh yourself, you might want to go again and hand express from both breasts again. You can collect your colostrum into a syringe, into a universal container, or into a little feeding cup that we have in the hospital here. If you're feeding your baby your colostrum from a syringe, we'd encourage you to get your baby first to latch onto your finger. So if you wash your hands really well and then get your finger into your baby's soft palate with the pad side up and the nail down, they should start to suck on your finger, and as they suck you can slide the syringe down the side of your finger and give little drops at a time as your baby sucks. That way they're learning some breastfeeding skill of sucking and swallowing milk.